Hello, my name is Manon Campagna. I come from Quebec, Canada, and I am an international board certified lactation consultant. Being a nurse who worked in maternal child care and also being a volunteer worker at La Leche League, I've had the opportunity to meet IBCLCs since a very long time. I was encountering people who were studying human lactation and breastfeeding topics, and it just was a natural part of my surroundings. And one day we went to a conference, and I remember riding in the car and chit-chatting with my colleagues. And one of them turned to me and said, "Why aren't you preparing?" And I said, "Me?" And voila. In 2002, I sat the exam and I certified for the first time. And I've been recertifying ever since. It's going to be 19 years. Actually, it is 19 years. So I've been doing recertification by CERPs and by exam. And I was so honored to be part of the healthcare team as an IBCLC. I worked in an environment in a hospital setting where I had the honor to do clientele one-to-one counseling. I had also the opportunity to sit on multidisciplinary teams working towards quality care. And that was a really amazing experience. And I was also a facilitator for continuing education to the healthcare staff. And so for the past 19 years, I worked on all these levels. And now I am a tutor at Healthy Learning for the breast ed courses. And I'm very happy to be here. I'm quite new and a very welcoming team. Being part of the Healthy Learning team, I find it to be so helpful. For one, I feel as if I'm part of a family, and I find that it's a great opportunity for the students to get that sense of community. It's a spirit that we are very fond of, because being part of the multidisciplinary team is all what IBCLCs are all about. Having the possibility to feel that you're part of a team on the inside and also on the outside, where you're going to go to collaborate with other healthcare workers, decision makers, or even families. So all levels will benefit. And most of all, having this community with the moms and the babies and the families and their babies, it's a great place to practice being part of a team. What I like about being an IBCLC and studying human lactation and being around breastfeeding topics, well, I like ethics. And I like to say that I have a crush on ethics. I think that's funny, but I do. But what I really love is listening. I love to listen to babies. I love to listen to parents talk to their babies. I like listening to students who have questions and comments and very interesting ideas. I like to listen to my colleagues because they're always so inspirational to me. But most of all, I love listening to stories that the families share. And through listening, I have gained so much knowledge. And it's linking this knowledge and this science-based information and sort of transforming that, or not transforming that, but linking that to reaching out and to what I want to say is, by listening, you have this rigor from the science-based knowledge, and you learn not to be rigid. And I think that's what healthy learning can give to the students as an experience, to become more and more familiar with this, And what will help students gain that is feeding their curiosity, clicking on the little links when they're following the courses, reading the new material, getting inspired to read more material, and then coming back on the forums to share and to have other people comment and listen to their comments. And this is a growing experience. So from there, what I think the students that are following the courses of healthy learning, what they can gain from these courses is a way to connect the knowledge with communication, with the intention, with the participation, in humility, and that's what is passionate to me too, is communicating that sense of importance, and in hopes that the students will one day maybe be a motivator to the next generation of IBCLCs. Thank you.